Experts speak on gender dysphoria, a presentation by experts by Kelly DeChan. Brief overview of gender dysphoria. According to Black and Grant, gender dysphoria refers to the distress that may accompany the mismatch between one's assigned gender and how a person perceives their true gender. The DSM classifications of this disorder reflect the tension within the field as to how best to conceptualize the disorder. The topic is gender dysphoria. Transgender individuals face a high degree of social stigmatization and discrimination, live in constant danger of physical and emotional harm, and have an extremely high rate of suicide. Both the diagnosis and treatment of gender dysphoria are controversial. According to Black and Grant, the area of sex and gender is highly controversial and has led to a proliferation of terms whose meanings vary over time and within and between disciplines. Should transgender individuals be able to use the restroom of the gender they present as? According to both psychiatrists and social workers, the answer is yes. In fact, they are protected under Title VII and OSHA guidelines in the workforce. Public protection is still currently being worked out and may be different from city to city, but this is an equality issue in which not allowing one to use the restroom of the gender in which they identify as stigmatizes them further and has detrimental psychological effects. What evidence-based treatment leads to the most positive outcomes? The most effective treatment currently appears to be a combination of psychotherapy and hormone replacement therapy, with some electing for surgical procedures as well, such as sexual reassignment surgery. Introducing the experts, Buddy McLevin, psychiatrist, and Diana Ross, social worker. Expert 1 obtained his bachelor's degree in psychology, took the MCAT exams, completed a Doctor of Osteopathic Medicine program, completed residency under a licensed psychiatrist, and became licensed under the Comprehensive Osteopathic Medical Licensing Examination. Expert 2, Diana Ross, got a bachelor's degree in psychology, then obtained a master's in social work, or MSW. She then was required to have 2 years of supervised experience and pass a clinical exam in order to become a licensed social worker. Expert number 1, Dr. McLevin. Although there is currently only a limited amount of studies on gender dysphoria, recognition of the issue has expanded, leading to further interest in increasing amounts of research. Currently, my main job is to assess individuals, making sure gender dysphoria is not a comorbid symptom of something else, make a diagnosis, and submit letters of recommendation for reassignment surgery. It is also common that I work in conjunction with other healthcare providers, such as endocrinologists, in order to establish hormone regimes. In some, but not in all cases, the individual may require additional therapy, which either I or a licensed psychologist can provide. Psychiatric comorbidity and mental instability seem to be important unfavorable prognostic factors for long-term psychosocial adjustment in gender identity disorder. However, even though gender identity disorder has been traditionally seen as a psychiatric condition, the majority do not have psychiatric comorbidity and generally are satisfied and live successful lives post-transition. The APA currently does not have a standard treatment recommendation. However, most follow the WPATH standards of care, as well as the recent Endocrine Society clinical practice guidelines. Most transgender individuals with gender dysphoria do not have psychiatric comorbidity, and psychiatric intervention is simply a current formality due to the way healthcare is set up. A website I would recommend would be the World Professional Association for Transgender Health, or WPATH site at wpath.org. Expert number 2, Dr. Ross. As a social worker, it is necessary that I advocate for the equal rights of others, particularly minorities. There is much research on the plight of transgender individuals. This includes discrimination in housing, employment, and healthcare, as well as harassment and violence. This may be a result of rigid gender binaries imposed by legal and administrative doctrine. Transgender individuals also have one of the highest rates of suicide. I'm actively involved in various transgender inclusive organizations and apply my skills to social change at the organizational level both globally and nationally. One recent change has been on a national level in regards to OSHA employment standards and transgender bathroom policy, which now protects transgender individuals when using the restroom of the sex in which they present as under Title VII in their workplace. At an individual level, I help advocate for transgenders and educate the community, as well as research and find resources in which individuals may require, as well as offer support in regards to life changes and adjustments. One website that I highly recommend would be the National Center for Transgender Equality at www.transequality.org. Dr. Buddy McLovin assesses and diagnoses, suggests hormone replacement therapy, provides various therapies, mainly psychotherapy. Diana Ross helps in providing resources, advocates for the LGBT community, and provides social support. Both of them submit letters of recommendation in regards to sexual reassignment surgery. They both work in conjunction with other healthcare professionals, and they both agree that there's a limited amount of studies in gender dysphoria. The end.